Hi, my name's Lee. I'm the nurse practitioner from US University. Today I will do the head and neck exam on my patient. So before I got in the patient room, I will review her chart, um, collect all the equipment, and wash my hand. And when I get in the room, I provide the privacy, and I will identify the patient, and I will ask for the consent. Hi, how are
Hi,
you?
hi, fine.
My name is Lee. I'm the nurse practitioner student from US University. Today I will do the head and neck exam on you. So is it okay? I have your consent. Allow me to post the video on YouTube so my instructor can see it.
Yes,
Can you tell me your name, please?
Thanh, my name Thanh.
And how about last name?
Dio, Đỗ.
Okay. How about your day of birth? Your day of birth?
Có tiếng Việt
What
nữa.
month you
À,
you born?
June,
June. Okay. What day?
30,
And the year?
1971.
Okay, that's good. So before, so now I will start to do the head and neck exam on you. Um, I will start with the head first. Before I start my head exam, I will do the inspection. I want to check the facial expression to see if like she have a normal facial expression or no any depression, and I want to look at it like her face like symmetry, even no facial drooling, no facial weakness one side, no facial involuntary movement, and her face like not swelling, no edema. So after that, I will check her scalp to see like how the scalp look like. Is it round or any head injury or any lesion? Okay, so I will look at your scalp now to see any head trauma, any lesion. Okay, so I will do the palpate the scalp to check her skull to see like is like skull normal cephalic or any lump, any pump, any cyst, any lesion. Okay, no hematomas. Okay, all right, no lump. So after that, I will check her hair distribution. Her hair like she have a thick hair, soft, no hair loss, and it good texture. And after that, I will do the eye exam on her. I want to check the visual acuity, so I will use the Snellen chart. So this is a pocket chart. So I will use it like for 6 feet away, and then like when I do this one, I will tell her like cover one eye to another eye. I will check one by one, and I will tell her like read from the top go to down until like she cannot see clear anymore. Okay, so I will stay away 6 feet because this is a pocket Snellen chart. So can you? Okay, this is 6 feet away. Okay, so can you read like the top one until down until you cannot see anymore? Okay, can you start? Can you cover one eye first? Okay, okay, look at it. Okay, start with
E, L, T, F, B, S, O, L, C, F, D, S, J, B, S, E, B, T, G, O, C, F, D, S, J, L, T, F, S, S,
okay. So that's good.
T, S.
Yeah. So can you cover another eyes? And we start with okay, another one. Can you do
E,
the same?
L, T, F, B, S, O, L, C, F, B, S, J, B, S, E, B, T, G, O, C, F, D, S, J, L, D, F, P, S.
Okay. So like her eye, your eye is good. It's like 20/20. So the top number indicate like distance the person is standing from the chart, and the bottom number is give the distance at which a normal eye can read a particular line. So she is normal with like 20/20 vision. And then after that, I will do the I will check the visual field by confrontation, each eye separately, then together. For this test, I will put the eye level with the patient around 2 feet away, and I have a patient cover one eye and look straight to me with another eye. And with my finger, I will check like if the patient have a I will do slowly to see the patient like with different direction to see if the patient can see it clear or not. Um, After that, I will use my finger. I will move to make sure the patient, when object is first seen, the patient will say now. And if abnormal, it means the patient unable to see object as I do. It will suggest peripheral field loss. At that time, I will refer the patient to eye specialist for more testing. Okay, are you ready for the test? Okay, so can you cover one eye? Okay, so can you look at me directly? Okay, so you don't move your head. So I will tell you, you tell me what number you can see, okay?
One, 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 two, one, one, one.
Okay, so I will move my finger, okay? When I move slowly, so when you tell me, like whenever you see my finger, the first scene, you will tell me, you say now, okay? All right,
Now,
okay. So this means, okay, that's good. It's the normal one. And then, so now I will start like inspect her eye. Uh, I will do the general inspection. Her eye, I can see like she doesn't have a exothalamus, no ptosis. And after that, I will check the eyelid to see like she have a, it's supposed to be pink and no pale. Okay, can I see your eyelid? Okay. So, and then I will check like if she have any like conjunctiva, like any pink eye, to see have any excessive like drainage, no abnormal discharge. Okay. Can I see? Two eye is good color, no pink eye. Okay. No drainage, no abnormal discharge. And after that, I will check like sclera, iris, cornea to see it's supposed to be sclera white, it no yellow or jaundice. Right iris, I will check if have any inflammation of the iris. Okay, it's no yellow, it's white, and it no jaundice. After that, I will check the people react to light directly. I will check with the light to see if have the people react or not. So it's supposed to be constrict equally and round, and we react to light. Okay. So can you look at me? Don't move your eye. Okay. Look at me. Look at me. Okay. Okay. So her people like 4 milliliter, it constrict to 2 milliliter, and it will react to life. And equal round. And now I will check I will do the assess for extraocular movement. It will including like 6 cardinal position of gaze. This test is check for eye muscle contraction. I will tell her to follow my pen line so I can check her muscle contraction for 6 feel. I want to check the cranial nerve number 3, oculomotor, number 4, trochlear, number 6 for abduction, and also at the same time I want to see if she have any nystagmus. It means like involuntary oscillatory eye movement. It resulting from a defect in the slow eye movement system. And I also check for the convergence to see if the patient have any inward rotation of the eye for near viewing. And the last one, I will check for accommodation. When it go close to her eyes, the pupil are supposed to be constrict, and if far away, it will dilate. So, okay. So I will check your eye movement. Can you follow? Okay. So this one, okay. Can you sit right? Okay. Can you see me directly? And don't move your head, don't move your eye, okay? So go here. Can you see? Okay, move right here. Okay. Right here. This, okay. This one?
Yes.
Okay. This one?
Yes.
This one?
Yes.
Okay. Go now. Accommodation. Okay. All right. So the next exam, I will do the ophthalmoscopic examination for 2 eyes. So like both eyes supposed to symmetrical, and I will like put the light dim a little bit so I can check the cornea and the lens. The lens supposed to be clear. It no upward because like it will show glaucoma if she have that. And also I will check the red reflect to see the light reflection in people. Okay. Okay. So okay. Okay. You have a good. Okay, she have a good red reflect and clear cornea and lens. The next thing I will do the inspection of vessel to check and also check for the optic disc and cup description ratio. So on nasal side of retina, I will check for the color of optic disc. Uh, it's supposed to be pink, and the optic disc supposed to be round and oval for normal side, and the margin distinct and sharply demarcated. Natural edge may be slightly fuzzy. Okay, and then I will look at this one. Okay, can you look at me? Let me see. Okay. So the next time I will check for her nose. First, I want to do my inspection and palpation for the nose. Her nose like smooth, it's like symmetrical, even. It's no lump, no swelling, no nasal discharge. And after that, I will palpate the sinus, frontal and maxillary. Okay. Can you tell me if you're in pain or feel uncomfortable? You okay?
No.
Okay, that's good. So now I will use the light to check the mucosa and turbinate to inspect inside nostril. Okay. Okay. So it looks normal to me. And after that, I will check her airflow for each nostril, and I will check her smell on each side. Okay, can you smell? Smell?
Yeah.
Okay. Can you cover one nostril? Okay. Can you inhale? Exhale? Is that
Yeah.
okay? Any
Yeah.
obstruction?
Yeah.
Okay. Can you do the similar? Okay. 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 All right. So now I will do. I will start do the ear exam. I want to check her hearing test for auditory acuity for the cranial nerve number 8. I will do the whisper voice, whisper test. I will whisper a common like 2 syllable phrase like apple or baseball, and the patient can repeat what I say. So now I will do the whisper test. Um, I will stay behind you. I will whisper one word, 2 words, okay? Very simple. And you repeat what you hear, okay? Okay. Can you repeat what you hear? Okay, yeah, it's right. I say apple. And then now I do the weapon test. It's a test to check if the patient have a normal hearing. Um, I will use this. It's tuning. It's a tuning fork. I will against my elbow and place on the patient forehead in the midline. So I will ask the patient whether the sound is here in the midline or has a lateralized. For normal hearing, the sound supposed to hear in the midline. For conductive hearing loss, the sound is loudest on the ipsilateral side to the hearing deficits. For sensory neural hearing loss, the sound is loudest on the contralateral side to the hearing deficits. Okay? So you tell me if like I will do this, I will put right here, and you tell me if you can hear equally both sides. Okay? You
Yeah.
hear it okay?
Yeah.
Okay. So this means she have a good hearing for both sides equally. Okay. And next I will do the ring test. This test to evaluate loss of hearing in one ear. So I will do similar like the Weber test, but I will apply the tuning force, place again the mastoid process for bone conduction. Then when the patient stop hearing it, I will hold it near to the external ear canal for air conduction. So for normal hearing or sensory neural hearing loss, air conduction is hearing better than bone conduction. This means the test will be positive. For conduction hearing loss, bone conduction is heard better than air conduction. It means it's negative. Okay, so I will apply this behind here. So you tell me when you no longer hearing it. Okay. Okay.
Yeah.
All right. You tell me when you stop hearing. Okay. I do the same similar like me. Mm-hmm.
No.
Okay. Okay. So she have a she don't have any hearing loss, so it's good. And now I will do the inspection for her ear. Okay. When I do inspection for her ear, first I will do with when before I start with the light, I will do the inspection for the external ear. I will check any like any discharge, any sign of infection, any inflammation, any drainage. And after that, I will palpate the external ear and tragus to see if she have any pain. Because if sometimes it in pain, it may be have an inflammation or possible like infection. It can, and I can inspect the pinna and the mastoid, especially tragus tenderness is a sign of otitis externa. Okay, so I will look. Okay, it's good. No training, no discharge, no redness. Okay, can I do another side? Same here. It's smooth. No training, no discharge. You have a pain?
No.
Okay. How about this side? Any pain?
No.
Okay. So I will start like use the light to look at like to look at the canal, the ear canal, to see any obstruction inside, any wax, any scar, or any skin chain. And at the same time, I will check the tympanic membrane. Usually normal, it will be have a gray color. I will assess for any redness. If any bulging, it can indicate some sign of infection. Also, when I look at by the light, I will look for the cone of light. The cone of light can be used to orientate. It's located in the 5 o'clock position when viewing a normal right tympanic membrane, and it will be 7 o'clock position for a normal left tympanic membrane. Okay, so I will look at inside your ear. It's good. It's normal. Can I see my side? Okay, it's good. No wax, no training. It's good. And next, I will do the mouth, throat, and face inspection. I will check, like I will inspect her lip to see any cracking, any shore, and I also inspect the buccal mucosa inside the cheek. I will check the salivary duct opening. I will also check for like any gingiva, any pigment, any infection. Also, I look at her teeth to see like she have any abscess, any cavity, any deformity. I also inspect her tongue to see the papilla and the side. I will check for the nerve like cranial nerve number 12 for deviation of the tongue. So I will start checking right now. Can you open your mouth? Okay, her lip is good. Her tongue is good. This look normal to me. Okay, no cavity, no draining, no abscess. All right. So I want to inspect her soft palate and uvula appearance. I want to see if she have any difficulty swallow, and the uvula is supposed to be in the midline. Also, I will check her tonsil to see if any pain, any mass, any lump, any redness, swelling. It usually grade from 0 to 4. And I will check the cranial nerve number 9 and number 10. So number 9, I will do the to see if she have any gag reflex. And number 10, I will tell her like take the tongue out and say R, so I can see the movement of her papilla and the uvula. Okay, can you open your mouth. Say ah. So I can see your tongue. So can you look up? Look up. Okay. Ah. Okay. Put your tongue out. Can you move? Okay. 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 Good. Okay. Ah. Okay. So her tongue so is like it's not swelling. It's no complete obstruction. So it's good. Number after that, I will check her like her neck to see her neck is will be supposed to be normal range of motion or not. So I will tell her like do flexion and hyperextension and lateral motion and rotation. So I can inspect like spinal accessory too, and will ask her to check the shoulder shrug for trapezius. And okay, can you help me check your? I want to check your neck. Can you follow me? Can you make a turn like this? Any pain?
No.
Can I do rotate up, down? Any discomfort? Okay. Okay. Can you do? Can you do like that? Okay. 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 Can you do the head turn against my hand? Okay. Turn. Okay. Okay. Do another side. Okay. Okay. That's good. So sorry. So now I will start palpate the lymph node. When I'm palpating for the lymph node, I will using the pad of 3 finger, 2 or 3 finger, and then kind of like do some circular motion. So the lymph nodes are usually pea-sized or larger. Normal lymph node, it move mobile, it's non-tender. But like if cannot be tender, fixed, and hard, it will require more workup. So palpation of the lymph node, I want to start like to check if you have any lump. Okay. So if you feel pain or any discomfort, just stop me from that, from there. So I will do some like circulation motion, okay, around to check. So like first I will check the free auricular. It's in front of the ear. Post auricular is behind the ear of occipital at the base of the skull, and tonsillar at the angle of the jaw. And I will check the submandibular. It's under the jaw on the side, and then submental under the jaw in the midline. And then I will check the cervical anterior. It's over and in front of the sternocleidomastoid clavicle. Okay, so you ready? Sorry. 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 Okay, now I will check the lymph node. Okay, so this right here is here. It's pre-auricular, and I go down here. The back is posterior auricular. Okay, this like occipital, and then it's the superficial cervical, and then I will do posterior cervical. Okay, and this is supraclavicular. So I will check right here for submandibular. Okay, and here is submental. So it's no DVG. Alright. Okay, this one, no DVG. Okay, that's good. So the next one, I want to check the trachea placement. It's supposed to be in the midline and no mass. Okay, you want to look at it. Okay, it's in the midline, no mass. Okay. And now I want to check the thyroid gland. So I will do my inspection. I will sit at the tangential view. I will sit behind the patient and apply the hand below the isthmus of the thyroid, and I can feel the cricoid cartilage, and I will ask the patient swallow. So I will check. I will do the inspection for swallowing too, so I can see like any visualized thyroid upon swallowing before palpation with swallowing. I want to see any lump, any knot, any pump, any tenderness, any pain, any discomfort. I will look at like if the patient have any goiter, because if the patient have a lot goiter, we can easily able to see it. So I will do thyroid check. Okay. So can you swallow? Swallow?
No.
Okay. Any pain?
No.
Any discomfort? You okay?
Yeah.
Okay. So she doesn't have she have a good thyroid gland, and she doesn't have any problem with swallowing. So I will finish my head and neck exam. Before I stop, I want to know like if you have any more questions for me, are you okay?
Okay.
Okay. So thanks a lot for your help today. Yeah. Thank you.